Perhaps if I could just start with, just tell us a little bit about the initiative.
So the coalition was founded in 2022. It was really born out of the belief that addressing child and youth mental health requires concerted and collective action. And so it has today become the largest private sector alliance dedicated to driving action and investment in youth mental health globally. And we're currently focusing on mobilizing private sector leadership. In the last 2 years, we have united 8 global brands and organizations, including Spotify, Lululemon, Sony, Pinterest, and more, and driving over 35 million US dollar investment into UNICEF mental health programs globally.
That is absolutely fantastic. And I hadn't realized quite the scale now of the funding that that coalition has brought. What are the benefits that you have seen of big brands and big funders like this coming together and working collectively in this way?
I see three main kind of categories. So the first one, and I'd love also Zeinab to please compliment on each of them, but I think is the opportunity and the benefit of pooled funding for programs. Collective investment can really enhance impact, efficiency, long-term sustainability, which I think is really critical to reach every child where they are. We also see huge benefits around joint advocacy and systemic change. And the coalition has managed to unite these brands behind a shared agenda, really looking at amplifying their collective voice to drive meaningful change. This kind of multi-sectoral approach, I think, can really help us drive some of the big advocacy efforts that we see at global and local level, shaping policies, influencing also business practices and global narrative. And then the kind of third kind of benefit I see is around kind of thought leadership. And this is really a platform to connect, to exchange insights, to co-create solutions. We are providing that space, which also includes the possibility to really drive responsible business practices, to sharing expertise, integrating mental health into corporate strategies. And I think this is really where we see also huge interest from the partners that we are engaging.
Yeah, thanks so much, Nazila. Yeah, I mean, I think just to really reaffirm that for us, at the systems level, the ability to pull resources has also meant that we can really go beyond pilot projects and really support sustained, scalable programming. And from a field perspective, country colleagues will often tell us that this kind of coalition is rare. It gives them not just resources, but also legitimacy. I think we are, through the coalition, we have the sense of shared purpose, and really working together to open doors with governments and help, secure, the resources that are needed to drive field level and national level action for policy reforms, and it really does motivate our multidisciplinary teams, from education to health and child protection, and really kind of work closely together. And so I think for us, the coalition is about driving, financial resources, but it's also about like a mind share. Our private sector partners, they are really helping us bring new ways of thinking and storytelling, and engaging the field in ways that we wouldn't reach otherwise. And the reason why it is able to do that is because it's able to really address needs where they are needed most, providing UNICEF that flexibility, and the autonomy to kind of work with countries, establish the clear funding gaps, and then use the coalition to really work creatively and think of ways to help address those needs and those gaps in a very intentional and strategic way.
I was struck when you were speaking that it is so sensible and impactful, and yet you said it's rare, and you're right, it is rare for coalitions to come together in this way. And so I guess my next question is a realistic one, which is what are the challenges that you faced and how have you overcome those challenges to be as effective as you are so that others can learn from it in similar ways coming together and facilitating scale in the way that this coalition is doing?
I think this is both, sometimes a challenge, but also a strength that, we have. We have this amazing network of teams, to Zeinab's point, in headquarters, in the regions, in the countries. We have UNICEF national committees in high-income countries that help us drive advocacy and resource mobilization. We have our country offices that, of course, doing both programming, advocacy, partnerships. And I think to really align everyone behind this coalition took a bit of time, but it's just, the nature of coalition and multi-stakeholder platforms and partnerships. I think there is also sometimes a misconception about coalitions and the resources needed to manage and drive these kind of platforms and initiatives. And I think, we had to test different models before finding a model that works, also in terms of the resources and the contribution that the members would make to the coalition alongside the contribution they're making to programs. And then I think a very important point that we are constantly, of course, working on is on the need to really balance diverse interests. I think there's amazing kind of really interest and commitment from the partners we have to unite behind this shared agenda and objectives. But I think the reality is that everyone is also, balancing different interests, different priorities. And so to be able to find consensus and to find really these activities and work streams that unite most of our partners. I think within a coalition, you need to accept also that you will never reach full consensus and everyone agreeing, behind every decision. But I think it's about balancing different interests and ensuring that we continue to keep our North Star in mind and really trying to shape it in a way that fulfill most of the interests and priorities of our partners.
And if I may add, I think another challenge that we're navigating is, I think the sheer scale of unmet mental health needs globally. Mental health now is, one of the most urgent issues that is facing, young people, but the systems meant to support them, whether through education, health, or protection, they're under-resourced and overstretched. So I think that's why we really needed to think beyond, traditional financing models. And I think also another challenge, and probably, it's a challenge, but it's also an opportunity, is our efforts to help bridge the gap between the private sector and the public sector. So the coalition is primarily, private sector led, but it's deeply connected to public systems, right? Through UNICEF's country presence and through our government partnerships. So we're, really working to be intentional about how we can bring private sector innovation and influence and investment into dialogue with public institutions that are delivering services on the ground, but also through global fora, So I think for us, that's something that is a huge challenge, but something that we're working towards.
And I like your point about that's an opportunity as well, because it is rather than just focusing on, as you say, the funding, it is this co-creation of ideas and learning from each other and together getting to influence something much larger, as you say, something very holistic that you couldn't do on your own. It only comes through that kind of that collaboration and co-creation that you talked about. And so I have to ask, because the coalition has been going for how many years now?
2 years and a bit, yeah.
So this is probably an unfair question, but is there one thing that you are most proud of what the coalition has achieved in that time?
If I have to pick one, I think it will be, the ability to really bring a diverse set of actors from the private sector. I think we have, consumer brands, we have foundation that brings a different type of expertise and interest. And I think really to unite such a diverse set of private sector leaders under this umbrella, I think is quite unique and powerful. But I would also like to really build on the points you and Zeinab just made. I think, to really engage the private sector, not just as donors and funders, but really as leaders and advocates who can help us to drive action and advocacy at the global and local level, I think is quite important and quite unique. We don't see a lot of that. And I think this is really something that we want to continue to nurture and to build by bringing other global leaders and an organization behind this.
If I may, yeah, I guess if I had to also choose one thing I'm proud of, honestly, I would say it's about, how we've been able to draw resources to the field. That's the most important thing to me. I think sometimes global conversations around mental health, they get stuck at that policy or advocacy level. So I think what we've been able to do is really turn that momentum into real funding for country level programs. I think just the excitement from countries to feel that they're able to, develop ideas and see those ideas being funded and resourced is just, it's not just something I'm proud of, it's really something I'm so grateful for. So I think for me, this collective action, that we've established, isn't just about aligning brands or issuing statements. It's really, in the end, about making sure that countries are better resourced and that, we are, supporting outcomes, mental health outcomes in children and communities.
You're giving me goosebumps. I am so grateful for the work that you all do. I think it's fantastic. And perhaps with my last question, where is the initiative headed next? What's the ambition of the group in terms of going forward?
That's a great question. And we've just had a coalition annual meeting in Zurich and really amazing discussions. But we're also facing, as it's, visible across the world, a funding crisis for our sector. And UNICEF, of course, is also impacted. Our mental health programs are impacted. So I think first and foremost, we really want to continue mobilize funding and financing for MHPSS. I think we want to explore with you, with everyone, what type of innovative financing mechanisms can really help us achieve the scale of problem we're trying to address. This is really a top priority at the moment, but equally important, I think we want to continue to raise awareness, to drive engagement.
Yeah, I mean, honestly, you said it so well, Nazila, because I think for me, I also see you know, the coalition is kind of a test bed, right, for innovation and how mental health is financed. And, as Nazila mentioned, the funding crisis is real, and I think it's being felt really most acutely in fragile contexts where flexible, rapid financing can really make the difference between access and absence. So I think I'm really, we would love as we move forward, continue to see how the coalition can be positioned to fill urgent funding gaps in ways that are fast and flexible and field driven, but also perhaps an opportunity to, following the annual meeting that we just had as well, an opportunity to innovate financing as well. And, how can we link to other platforms, and really think about, financing models that could really drive us forward and accelerate our action through the mental health coalition. So really, I think the next phase is about being bold, not about creating a coalition that sustains existing efforts, but really pioneers new ways to deliver for young people and to really elevate financing and expand financing for mental health.
Nazila, Zeinab, you have been amazing. Thank you so, so much. And for anybody else who is feeling as inspired as I am and who would like to consider joining the coalition, we will put in a way to be connected with you into the link on this interview. But thank you so, so much to you both.